Good afternoon, everyone. It is 2:30 in the afternoon, East Coast time. A lot is happening where I am here in New York City. The city will go on lockdown. The entire state of New York will go on lockdown starting Sunday. And I did a really interesting interview this morning that I think is going to provide a lot of hope to people and information, specifically to doctors. There is an 87-year-old man on the island of Puerto Rico who is originally from San Diego. He was on board a cruise ship. He started having symptoms. He was airlifted from the cruise ship to a hospital in Mayagüez, and he is about to be released from that hospital. He is 87 years old. He had 5. Paddington is sneaking out of his enclosure. Okay, so now you're into jailbreaks, huh? He has 5 underlying health conditions. Hi. 5 underlying health conditions which would make him really at highest risk of dying from COVID-19. He had COVID-19 and he is about to be released. He survived. So I will have that story coming up soon. The reason I wanted to join you is for one thing as of right now. We'll do more of the conversating that we've been doing and the sort of sharing and engaging as a community. But right now I want to bring in Daniel Colon Ramos, who is a professor at Yale University. He has reached out to me to say, David, I have some significant concerns regarding the individual who is acting as the Puerto Rico epidemiologist. And the reason this is important is because the epidemiologist is advising the governor, and she is directly involved in working with cases on the island. There was, David, put the volume up. Can y'all not hear me? Is the volume bad? Is it bad? Put your mic in front of your jacket. Is this better? Volume up. Is this better? I can take the headphones out. How's this? This should work better. So Danielle, who is a scientist at Yale, reached out to me and said this woman needs to resign. And I started to listen to him, and I started to listen to others on the island who are saying, listen, the lady is providing information that is misleading and factually inaccurate. And look, usually I'm not into getting into turf wars with people, but we are in the middle of a pandemic, and this is a global health emergency. Puerto Rico is an island sitting in the Caribbean, and so misinformation by anyone, by the media, or especially someone involved in government, is crucial. So I've asked Daniel to join us to tell us why he thinks she should resign. And he is, he may be at the university or he may be at his house.
Hi, David. How are you?
I'm good, Danielle. You're at the university in your office, I can see.
I am, yeah.
Okay.
It's actually shut down. This is the last day that we are allowed into this space. It's a little bit sad to say bye to the lab, but it's necessary.
It's necessary.
And these are special times that require special measures.
Okay, so let's get to the point. Specifically, what is your stance on this woman? I've already made it clear that you are calling for her to resign. Is that correct?
That is correct, David. I publicly stated yesterday on Twitter that I thought that she should resign from her job as epidemiologist of the state. I did that. I don't take that lightly. I have never requested publicly a resignation from an official before, but I thought that it was important to say what I knew to be true, which is that this person has consistently ignored data, scientific facts, evidence, and have said things that, frankly, I feel like put the lives of people in Puerto Rico in danger. Specifically, as recent as a few days ago, she said that the only way that you could get coronavirus is if you were under prolonged exposure, direct exposure with a person that has coronavirus. And that is patently false. There's no data that sustains that. If you are under prolonged exposure with somebody with coronavirus, yes, you're likely to get coronavirus, but you can also get it from casual contact. You can also get it from touching something that somebody else has touched with coronavirus. It requires strong measures to avoid getting infected by coronavirus, such as cleaning your hands frequently, staying at home. And I felt that this type of statements were both incomplete, confusing, and dangerous for the people of Puerto Rico. This is the same epidemiologist, David, that when the epidemic started, she said that we didn't have to worry Puerto Rico because the reason that Italy had actually a breakout of coronavirus was because Italy was close to China, which is not only incorrect in terms of geography, but it gives me pause when I think about how that might have affected policies weeks ago in the government of Puerto Rico, policies that could have protected us then, which are now affecting us because of the type of frameworks that you used.
This is, for everyone who's asking who we're talking about, this is Carmen de Seda. She is the island epidemiologist in Puerto Rico. And adding to what Danielle is saying, and what Danielle is telling you, involves information that you can Google and see for yourself, specifically what she said and when she said it. This is not secondhand information. This is through quotations that are in the press. Today, there was some reporting based on an interview that Ms. de Seda gave, where she said that when we see that there has been no out of normal increase in the number of the respiratory syndrome, COVID-19, she said, this gives us a signal that COVID-19 virus is not currently circulating.
And look, David, those statements are very problematic. Like, this is the epidemic, the pandemic of the century. This is the pandemic of our generation. The countries that are succeeding, that are beating this thing, are taking it very seriously. And they're using evidence, they're using science to come up with policies that are protecting the people.
But specifically to make it clear to everybody watching, you cannot make a statement that it's not circulating unless you have the data to back up your speculation or your knowledge that it's not circulating. The Puerto Rican government has done less than 100 tests. It is impossible to make broad, wide-ranging and
statement like that.
Assertions, correct.
So when you, and the problem is that if you make a categorical statement like that, you have to think that these are the categorical statements without evidence that this epidemiologist is making publicly. So what does that do? That confuses people. That leads to public health actions that are not evidence-based. And I wonder what she's saying privately that is guiding our epidemiological strategies.
And it should also be known that the reason, again, I don't, people call for resignations at various times. The reason I wanted you to hear from Danielle is because we are talking about a lady who is advising the governor of the island. The governor is getting a lot of her information directly from this lady because she is in charge. Now, let me give you a couple of updates. As of a week ago, the epidemiologist was in charge of deciding who got tested and who didn't, because there is a shortage of tests, not only in Puerto Rico, but everywhere, okay? So the secretary for the Department of Health was fired. The governor said he resigned. He was fired. The woman who took over told me in an interview that the epidemiologist is no longer involved in the process of deciding who gets tested. She has been taken out of that mix. Now it is up to the doctor to write a prescription saying this patient should get a test, and it can only be for a patient who is inside of a hospital. Can't be for somebody at home, can't be for people walking around who just want to, you know, feel better because they kind of feel sick and they think they might. You got to be in the hospital as a patient, and your doctor's got to write. So the epidemiologist has already been removed from that equation, which is critical. But she is still giving official statements that, as Danielle is telling you, are widely publicized and inaccurate on at least 2 or 3 different occasions.
And David, one thing, many people might not have thought about the importance of the epidemiologists of the state until this crisis. So let me explain what is the role of a person in that position. That is the person that is watching out for the public health in Puerto Rico. This person is not only not supposed to be making statements that are incorrect, but she's supposed to be using data to set up the strategies that are going to protect the people in the future. This is the person that weeks ago should have been looking forward, thinking about the test, about how they were going to respond to all these crises. Right now, they should be looking forward, thinking about the ventilators that we're going to need, thinking about the beds. If this person, in her public persona, she's sending confusing information, I don't know what kind of strategies, as you're suggesting, she's advising. Now, this is going to get far more complicated. This is just the beginning of the epidemic. We're just entering the epidemic right now. We're starting to do some tests. We need. I think it was great that yesterday the governor in Puerto Rico, she announced this cohort of people that are going to join the task force, who are medical doctors, well-trained, knowledgeable, with no political ties that I know of. She needs the best advisors. I don't know this epidemiologist. I have no dog on this fight other than caring for my people, the people of Puerto Rico. So when I denounce that, I think she should step down. It's not personal. I feel bad that she will have to, but I will feel worse knowing that she's at the helm of what should be the most important epidemiological decisions in the history of Puerto Rico as we're entering this crisis, knowing what I know about her public statements. Her public statements are inaccurate, they're flat out wrong, and we need somebody there. We need an all-star team. We need people that really are proven epidemiologists that can take us to safe harbor.
And we should let it be known that the Center for Investigative Reporting in Puerto Rico, which does terrific work, has a report out. There's an English translation that's coming out this afternoon, which I will share, which says that Ms. DeSeta, the epidemiologist, does not have a master's in epidemiology, that she attended a course, correct me if I'm wrong, Danielle, but back in the 80s?
Yeah, that is correct. She took a course. But look, I was sharing this with somebody earlier. Sometimes people learn at the job. So let's suppose that she had taken that course, and I don't object as strongly to that, because let's suppose she had taken that course and she was killing it at the job. She was decisive, she was clear, she had a clear strategy. I would have no problem with the fact that that was part of her training. Sometimes people learn from experience. But the problem here is not so much her past training in the 80s. I think that's a course that she took in the 80s. The problem here is that what she's saying is inaccurate and misleading to the people in Puerto Rico. And I think when you're in a position of leadership, tell people, look, the only way you can get contaminated is through prolonged exposure. When science is telling you that's not true, casual exposure will get you infected. When you're talking about, she talked the other day about autochthonous cases. She's like, there are no autochthonous cases in Puerto Rico, which I don't even know what that means. Like in a pandemic, what do you mean by that? Particularly when the tests have not been run in Puerto Rico to know how many people in Puerto Rico are having this condition. And if you're basing policies based on lack of information, if you're not using data and you're making assumptions, and then you say, okay, well, I don't know of any cases in Puerto Rico because I haven't tested, so I'm just going to assume that there are no cases. That's not good science. That's not good epidemiology. And in a crisis like this, that translates into lives.
The reality is, whether she has the training, whether she has the degree, she is in the position, and the statements she is making during this time in this position are concerning, and they have been factually inaccurate. And as of the last report I saw a few hours ago, she still maintains the support of the governor, at least for now. So, Daniel Colon Ramos, thank you. He is a neuroscientist at Yale University. People have asked for your Instagram handle. What is it?
It's DACOLON. Daniel, the A is for Alfonso, which is my middle name, and then COLON, Colon. DA Colon.
Okay. And a proud native of?
Barranquita, Puerto Rico.
Barranquita. Thank you, Daniel.
Thank you, David.
All right. So I thought it was really important that you all heard that. I will post this on my other accounts, Twitter and Facebook, just to let folks hear it. Listen, I've never met the epidemiologist. She may be a very nice lady. In fact, I've talked to people who know her and say she is a very nice lady. You can be very nice and not be right for the job. So I just wanted to share this with all of you. Danielle actually just left his, you can see if you're looking in the comments, his handle, D.A. Colon, D-A-C-O-L-O-N. I will be back a little later on this afternoon, and we'll do a usual sort of community gathering to find out what your new normal is where you are in the world. I'll see you then.